We do not yet know all the ramifications of overturning Roe v. Wade, but a new study suggests a link between access to abortion and maternal mortality rates. According to research from the University of Colorado, a nationwide abortion ban could increase maternal deaths as much as 24%. For Black women, researchers estimate the increase at 39%. Maternal mortality rates vary state by state, but if the 26 states that have already banned or plan to ban abortion had not performed the procedure in 2020, researchers found there might have been as many as 64 more maternal deaths. Joining us now is Amanda Stevenson. She's an assistant professor of sociology at the University of Colorado Boulder, and she is also the study's lead author. Professor Stevenson, welcome. Good to have you with us.
Thank you for having me.
I don't want to put too fine a point on your study, so please tell me if I'm dealing in hyperbole or generalities. I want to make sure we get this right. But it sounds like the upshot of the study is to try to explain how abortion services can literally save women's lives, how there's a direct link between the mortality of the mother and her ability to abort a pregnancy under an array of different circumstances. But that sounds like kind of the upshot of the study. Do I have that right? Am I missing anything?
No, it's basically just arithmetic. Staying pregnant is far, far deadlier than having an abortion. And so every time someone is prevented from having an abortion that they want, they're exposed to a much greater risk of dying than they would have been if they had had the abortion. So it's just math.
Explain that if you would. What is it? And I know this sounds like a very facile question, but I think we're learning there are some things about pregnancy and maternal mortality that some folks just don't know. What is it about pregnancy that makes it so much deadlier when abortion is not an option? Can you elaborate on that?
Well, so in the study, all we did was take the number of abortions and estimate how many of the pregnancies that would have ended in abortion would instead end in birth if abortion were not available, and then applied maternal mortality rates as they currently exist to those births. So that is just saying, imagine nobody could get abortions and pregnancy stayed exactly as dangerous as it is right now. And unfortunately, the truth is people who have abortions are systematically less advantaged than people who have births. And so the people who have abortions who would be forced to stay pregnant, if they weren't allowed to have abortions, would have higher risks of dying, not the same risks of dying as the people who have births. And so the estimates that we have are very conservative, which means they're lower than we would actually expect in reality.
Zooming out a little bit from this study, why is maternal mortality so high in the U.S.? I mean, compared to other nations, the mortality rate, I mean, you can see at the top of the chart, it's kind of incredible. About 24 deaths per 100,000 live births in the U.S., which as an absolute number is very small, but France, it's fewer than 9. Canada, it's fewer than 9. The UK, fewer than 7. Germany, it's about 3. New Zealand, it's fewer than 2. Why is maternal mortality so very high in the United States?
So this is a very difficult question. It doesn't have a simple answer. The truth is that the United States fares very poorly on indicators of health when compared with other rich nations. And this is, just like our life expectancy is lower than other rich nations. We lose more pregnant people than other rich nations too. But maternal deaths are mostly preventable. So this is an indictment on our society. People shouldn't die because they're pregnant. Those lower rates that we see in other rich countries, we could have rates like those if we took care of pregnant people the way that they do in other rich places. So this is about healthcare, but it's not just about healthcare. It's about underlying health conditions. Do people have access to safe and healthy communities, good access to quality, not stressful lives and so forth? Like, it's hard to be disadvantaged in America in a way that is really stressful. And this is especially true because of the legacy of racism in this country. When people used to ask me this question when I was much younger, I would just literally answer, well, racism. It's there's more to it than just potentially racism, but the truth is that racism is a fundamental cause of many of the inequities that we witness. And the rates of maternal death are higher for all race ethnicities than they should be, but they're much higher for Black people, much, much higher.
Before I have to let you go, you kind of hinted at this, but I know Vice President Harris spoke at the Essence Festival a few days ago and said that the Biden administration is trying to address maternal mortality. Is there anything that you think should be at the top of their list?
Yeah, so there are a number of researchers that have been working in this area, as well as activist groups. The National Birth Equity Collective, Rachel Hardiman, Monica McLemore, and other scholars have established a sort of a toolkit for advancing better health outcomes for Black women in particular. And they've made it very easy. I know that they're working with leadership, but they've laid out exactly what needs to happen. And it's a lot of stuff. It's not a small lift because our country is truly unequal, and it's that inequality that generates these tragic statistics.
Professor Amanda Stevenson from UC Boulder, appreciate you breaking down your research for us. Thank you very much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.